Okay, so first we have a few reminders. So during the call, please mute your line so that any background noise and conversations will not become part of this recorded presentation. The mute feature is located in the lower left corner of the window. And to ask a question during the presentation, please type your questions into the chat box. The presenters will take time during and after the presentation to answer those questions. You can also raise your hand to be called on or unmute and speak at that point when we call for questions. If we run out of time and you still have additional questions, feel free to send those to the Youth Health Transition Initiative staff. We will put the email address for our group in the chat box. And I see some of you already did this, repeat attendees, I guess, but to help us track attendance, please put your name and organization in the chat box. If you're on the phone, please email your name and organization to the email address for Yeti that we will put in the chat. Okay, a recording of this presentation will be available on the Health Transition Wisconsin website. At the end of the call today, please complete the evaluation at the link provided in the chat box. And if you must leave early, please complete the evaluation before logging off. So during our presentation today, Julie Hajewski, who is on our Youth Health Transition Initiative team, and Wendy Sun, a LEN trainee, will talk about their work doing an environmental scan of health transition practices in Wisconsin health systems. And afterward, Ann Harris, the Youth Health Transition Initiative Director, will lead a discussion. So let's get started with our presentation.
Good morning or afternoon, I guess, as the case may be. It's nice to see all of you here today. Thanks for joining us. Let me get our slides moving in the right direction. So this is our plan today, our learning objectives for the call. We hope that all of you will have the opportunity to describe the process for conducting an environmental scan of transition practices in Wisconsin healthcare systems. We hope that you'll be able to discuss some of the initial challenges, barriers, opportunities, and learning points that we're going to identify today. And we're also hoping that maybe you'll be able to list at least one idea to address issues identified in our environmental scan. So those are our objectives for today for all of you. Who are all of us? So I'm Julie Hajewski. I'm an adult nurse practitioner. So 70% of my time I work at UW Health in Beaver Dam, Wisconsin, practicing rural internal medicine, and that's where I am today. So hopefully we don't have any intrusions, I should say, into my office. And when I'm not here, 20% of my time is done at the Wiseman Center with about 4 hours per week working with the Wisconsin Youth Health Transition Initiative. I work in provider education with the Transition Initiative. I work with health systems and individual clinicians and practices, helping them technical aspects of transition implementation and education. And I will let Wendy and Ann introduce themselves.
Hello, everyone. Thank you, Julie. My name is Wendy Sun. I am a graduating fourth-year medical student over at UW School of Medicine and Public Health. After graduation, I will be attending the University of Minnesota as a pediatric resident, and I had a lovely time getting to know both Julie and Ann during an elective course during my training where I was able to learn from them and be a part of this project. So big thanks to them.
Thanks, Wendy. Hi, I'm Ann Harris, and I'm the Director of the Youth Health Transition Initiative at the Wiseman Center and also the Wisconsin LEN Director. And my background's in public health and evaluation. So I'm going to introduce the context of this environmental scan that we conducted, which is the next slide, and say that in Wisconsin, the Title V block grant, which is our MCH funding to the state, and that's renewed every 5 years. The block grant selected transition as a national performance measure to work on. And so our Youth Health Transition Initiative is a direct result of that focus on youth health care transition to adult care. So the state performance measure that the state defined to address this national performance measure, and this is all MCH lingo, is that the percent of children with special health care needs who received services necessary to make transitions to adult health care would increase over time. Is the measure is the percent of children, and what we're hoping is this would increase over time. So we have a work plan for our contract with the state, and one of the activities this year and last year was to conduct, and this year to continue, an environmental scan of major healthcare providers. Our goal was to learn what our healthcare system's doing in Wisconsin to promote better practices in the youth to adult transition in healthcare. So our measure that we came up with was, as a result of the environmental scan, to be able to determine what percent of systems or practices have a transition policy or guideline in place. And we defined that as a formal written commitment to transition and transition care. So we have started this environmental scan, and we're in the process of determining that percent of systems or practices that have this guideline in place. That's our ultimate measure, but we learned a lot more. And so Julie and Wendy are going to tell you how we did that.
All right. So I'm going to talk to you in the next few slides about kind of how we started our environmental scan and some considerations that our team took in mind. So our first challenge was determining major health systems in Wisconsin, which sounds simple at the outset, but actually we spent quite a bit of time about this, and a lot of different criteria that one could look at when you're thinking about what constitutes a major health system. Inpatient beds is probably one of the first places that I went to as a practicing clinician, but we also talked about number of locations for different organizations and facilities. We talked about maybe looking at number of outpatient visits, as we often will see that sometimes when we look at a website or a health system, they'll say how many outpatient visits. But when all was said and done, we determined that a lot of these were really difficult to find accurate measurements for. And so ultimately, one of the most accurate measurements that we thought we could identify was those inpatient hospital bed numbers. And so my next slide here, if we can make it behave, talks about calculating those inpatient hospital beds, because once we decided on that measure, there still is a lot of variance in this when you start looking. We looked at 3 major websites for calculating those hospital beds in Wisconsin. One was what's called our WCHQ, or our Wisconsin Collaborative for Healthcare Quality. The second was the Department of Human Services Hospital Directory. And the third was a resource called the American Hospital Directory. At the end of the day, we ultimately utilized that Department of Human Services Hospital Directory. We did make a conscious decision, though, to not include affiliate locations and really look at those main hospital facilities for inpatient. And the reason being is because it was really difficult to accurately identify affiliates. As we know, in this world of behemoth health organizations, different organizations are acquiring and releasing different facilities all the time. And so sometimes it's really hard to identify who's the current owner, if you will, of those affiliate organizations. So this is the final list that we ultimately came up with. We identified these top 10, if you will, based on their inpatient bed numbers for their main hospital organization or main hospital buildings. So as you can see, the list there in front of you represents a wide geographic area of the entire state. And small to large, because at our smallest numbers, we're talking about 500 to 600 beds versus thousands of beds when we get to the top of the list with Aurora, Ascension, et cetera. We didn't permanently exclude those smaller systems. They're still on our spreadsheet, and they're still on our mind, in the sense that if we didn't have response from our larger systems, we knew that we could go back to that list and pull from our smaller systems. Or if our process was so efficient that we had time, that we could use some of those smaller systems. When we got down to looking at who are we going to be talking to, how are we going to identify those key informants, we looked at a lot of different providers and clinician roles and considerations. Pediatric physicians is kind of the go-to, right? We know those are our champions in the area of transition doing that work on a daily basis. We talked about med-peds physicians. There's a shortage of med-peds providers in our country, but also well-poised to practice transition in our outpatient clinic settings. General internal medicine physicians. I work in a general internal medicine practice, and we definitely receive many of these patients. Pediatric nurse practitioners also well poised to be doing this work. RN care coordinators and social workers are also doing a lot of transition work, as many of us know when we talk about different clinics and practices. Strategies to contact key informants. This is our current list, and this has been a growing and changing list as we've continued to work towards identifying key informants and systems. The first place we started is with our previous Youth Health Transition Initiative Quality Improvement Grant recipients. We've over several years had several grant recipients prior to the last 2 years, and they've been a great wealth of transition related information for us. So that was the very first place we went. We did a lot of networking with our current working contacts and systems. A lot of those are UW based because geographically where we're located, but I did a lot of networking through our contacts that we talk to all the time about different aspects of transition. We had a med-peds colleague here in Wisconsin who's now retired, but he was very helpful at maybe helping us access some of those med-ped providers in the state. He also worked with our regional centers for the CYSHCN network, specifically pushing some emails through our information and resource specialists to say, hey, who are your go-tos for resource key informant providers that we could potentially interview and utilize in this process and in this scan. I had a very brave and amazing NP student through our LEND program who did some cold calls to a couple of health systems and was able to identify a couple of resources and key informants that we did ultimately interview through those cold calls to health systems. And more recently, Wendy, doing some work with me, was able to identify some providers through public web pages with hospital systems and health systems. And we also utilized an app called Doximity. Some of you may be familiar with that. Doximity is an app that we use to, for example, when I work from home, I will use Doximity I can call from my personal cell phone and it'll show up as my office phone number, but they have a directory resource also, because we had some specific provider systems who said, hey, can you fax something to my clinic? In the world of medicine, we still love that fax machine. So Doximity helped us be able to access some of those clinics and providers with a fax number. Our next steps, and many of these steps were, of course, happening concurrently, but one of the other processes was developing our interview questions. We did do pilot interviews initially. We started with 6 general questions, things along the lines of, do you have a policy? Who's practicing transition in your clinic or system? And then developed implementation questions. So very specific. Are you using an electronic health record with yes or no's, and maybe some follow-up questions related to that? Are you using transition readiness assessments of any form, et cetera? And then we had one follow-up question. Is there anything else you want to tell us about? So we had 5 pilot questions also for our first pilot interviews, and those really looked at the length of the interview, the quantity and the quality of our interview questions. Ultimately, through that pilot interview process, we retained our original 18 questions, but added a couple of extras. That who else should we talk to or interview in your system to help identify further key informants? And that question of how can we, as the Youth Health Transition Initiative, help you on your transition work? What are the next steps that we can help you take? for actually conducting interviews. We did go through the UW IRB QI program evaluation self-certification tool to identify that this was indeed certified as a QI project. All of our interviews thus far have been conducted by myself via Zoom. I've had some additional attendees at time. Wendy has attended one of my interviews to learn about that process, but thus far they have been conducted all by myself. Our interviews have lasted between 30 and 60 minutes, and each and every one of our interviews have been audio and video recorded for transcription purposes later. Those first pilot interviews we actually did with 3 providers that we were all familiar with at the Yeti, individuals that we have regular contact with and we're comfortable doing that pilot interview process. 2 of those interviews ultimately were within our target 10 largest systems, so they are part of included in our collected data for that environmental scan. And one of the other interviews was with one of our smaller systems who is very active in their transition work, and so was a person very familiar to me to do that pilot interview process with. Each and every one of our interviews ultimately generated 3 sources of data. We have my personal notes that I took during those interviews and have collected and cataloged. We have that recording that I mentioned that had audio and video recordings. And also then we have transcripts of each one of those interviews as they were transcribed later. Thus far, we have conducted interviews in 5 out of those top 10 systems that we identified on that screen, that slide a few slides ago. They're color coded here for you today, a couple of pieces of information on this slide. The items that are in yellow, those 3 systems, as far as we're aware with the interviews we've conducted, they do not have a known transition policy or guideline. So that's those 3, Ascension, Freighter, and Aspirus. The 2 in green, UW and Marshfield identified, they do have a transition policy or guideline in place. For the other 5 systems you see listed there, you'll see 3 of them with a single asterisk next to them, Aurora, SSM Health, and Pro Health. We have identified contacts in there in each of those systems, but we have not been able to get a response, have not been able to conduct interviews. And there are 2 systems you'll see with the double asterisks, Mayo Health System and our Hospital Sisters Health System out of the Green Bay area. We have not identified any contacts or transition champions, key informants in those systems to interview thus far. And next, I'm going to let Wendy take the next few slides to tell you about the literature themes and then the themes that we have preliminarily identified. So Wendy, you go for it.
Thank you, Julie, for very eloquently describing the methodology and introduction to this project. I'm grateful for the opportunity to be a guest on this project, but with full acknowledgement that Julie has done most, if not 90% of this work, if not more. So when I was first introduced to the project, what was really helpful for me was to understand some of the themes that were talked about nationally. And one of the reports that was published by the American Academy of Pediatrics really did a good job of outlining some of these themes that have been talked about for many years. So this one was released in 2018 as an update to their clinical report on transition from 2011. And 2018 was not that long ago. And so I think it was really helpful to see what they identified as important themes to compare to what themes we have identified through our interview and environmental scan process. So one of the first themes that they identified was challenges with infrastructure. And under infrastructure, they discussed the challenges of integrating transition within routine care, routine preventative, routine primary, subspecialty, specialty, and behavioral health care. The other additional challenge is needing more QI processes within healthcare system to talk about the outcomes and processes around transition. The other thing they identified was care coordination needs around transition and the need for increased availability and quality of care coordination. And then under infrastructure, the other additional pieces talking about needing pediatric consultations for our adult medicine clinicians who may need additional assistance with taking care of these youth or adults with complex medical needs. And then as well as creating a listing of community resources that are tailored to local resources for adults with disabilities. The other piece that was talked about is payment. So payment is, as I'm sure many of you understand, a huge challenge to transition because we're not really able to adequately compensate our clinicians and systems of care when we perform these recommended health transition supportive activities. And one of the barriers to that is the lack of formalized CPT codes needed to track and to reimburse for these sort of activities. The other challenge that they mentioned was research, needing to understand more about the outcomes of transition and having more information about national quality measures around transition. What is the state we're currently at and how does transition activities improve those outcomes? The other type of outcome data that we need more of is long-term outcome. As with anything talking about prevention, it's always a huge challenge to define how it benefits our patients over the long term. The other things that they talk about in this clinical report were barriers. And the first one is barriers to youth and families. So there's this fear that youth and families have of a new healthcare system when they're transitioning from a pediatric system to an adult system. There's the loss of rapport that they have built with their pediatric institution. And there's anxiety around relinquishing control over management of pediatric conditions when transitioning to adult care. The other challenge too is having inadequate time to plan, inadequate preparation. Oftentimes we recommend transition starting really early and more earlier than maybe people would expect in order to develop the skills needed for youth to adequately transition and to understand their medical needs. There's an acknowledgement of the interplay between socioeconomic status and their parents' SES status in affecting transition preparation as well. And system difficulties in terms of communicating between families and the healthcare system and clinicians and medical records. Lastly, I just want to touch on barriers that they mentioned for clinicians. They talked about communication and consultation gaps. They talked about training limitations, the limitations of adult providers when taking care of youth with conditions that are mainly taken care of by pediatricians. However, given their now transitioning to adult care, now they need to better understand some of these conditions themselves. They talk about staffing gaps, which is very, a problem that we have seen a lot today when we talk about needing extra staff, needing extra care coordination and support to really facilitate this process. And the lack of patient knowledge when transitioning, when there's not a good handoff, when adult providers are seeing patients for the first time, they often depend on patients and their parents to really understand their medical needs as well as medical history. And then there's also this lack of comfort with adult care, just having a different culture between pediatric clinics and adult clinics, and understanding that transition and the expectation shifts that happen. So that is, in a nutshell, some of the themes that were discussed nationally in this report. Next, I want to talk about some of the themes that Julie has identified after looking at the dictations of, or the transcriptions of the interviews that she's conducted. So to start off with, we want to talk a little bit about what we found that providers are doing in terms of transitioning from an individual clinic and a provider level. There has not been any preliminary evidence for systems-based transition care or programs. These activities are often carried out by individuals who are particularly passionate about transition, but some of the challenges that is that when you have these keystone individuals who are facilitating this process, when they leave or retire, oftentimes that leaves a gap in the system. And oftentimes these are carried by providers who span multidisciplines, whether it's from nursing assistants or assistants from other disciplines like social work, pharmacy, and support staff. So other themes we've identified with what the system is doing, we have noted that transition is supported, but often informally and without formalized funding sources. There's no systems-based methods identifying transition champions. Beyond some informal listings from welcome and care provider assignment centers, which is interesting in thinking about, how the challenges of having our patients and parents trying to identify who transition champions are when we are ourselves who are within the system are having challenges identifying these folks. The other theme that we want to talk about is there are rare isolated QI projects in assessing transition satisfaction, but there's no systems-based formal evaluation, which is very similar to some of the themes that were talked about in that report. So in terms of the numbers, we have looked at some themes, including there are no pediatric cutoff ages in outpatient settings. 1 out of the 5 systems that we've interviewed noted that inpatient pediatric ICU cutoff age of 21. 2 out of the 5 organizations that we have interviewed have no known formal transition readiness assessments. And there are no formal transition clinics in any of the systems that we have interviewed so far. 2 out of the 5 systems we've interviewed also do have a transition policy and guideline. So to talk a little bit more about what we learned and challenges, I will transition back to Julie to finish up the presentation.
So just a single slide here about some of those challenges and learning points. As Wendy alluded to just a moment ago, that difficulty in identifying our transition champions within systems. And if we as clinicians and individuals with the Yeti reaching out can't identify those key informants, those transition champions, what does that mean for our patients who are trying to identify those individuals that might help them through the transition phase of care? We also acknowledge that there may be some individual interviewee knowledge of system-wide efforts. It's tough. I work in a huge system at UW. I don't know everything that's going on here. So we interviewed individuals. Another challenge that was huge is the timeline challenge due to COVID and our ability to access healthcare providers. As everyone knows, the last 2 years with the COVID pandemic have really taxed our healthcare systems and individual providers. And so the opportunity to ask them, hey, can you take an hour out of your day to talk about transition has been a tough sell at times during the last 1.5 years. And as part of how we transition this work plan from last year into this year, trying to meet that challenge of provider time and accessibility. And the final one is that limited youth health transition initiative capacity and availability for interview scheduling. That's me. I spend about 4 hours a week or so with the Yeti. And so I'm pretty limited time in order to coordinate all of these events and interviews. But I like to think that we're like that tiny little plant down there in that crevice. We're continuing to sprout and grow and continue to do the work before us to help make transition better for our youth in Wisconsin. And next, I'm going to talk just a little bit about, see if we can make our slide here, what the interviewees requested from the Yeti, because this was an amazing thing that happened in every one of these conversations. And it's probably one of my favorite parts. I had a lot of people ask me when I said, well, what can we do for you? What can we do to help you take the next steps? A lot of requests for some technical information. Tell me about transition readiness assessments and where can I find one? Tell me about this coding part of things and how we can help get transition paid for in my clinic. Tell me about resources that might be available for my families and individuals. And so a lot of referrals back to our national partner that got transition resource. I had a lot of conversation about I'd love to have some more education for my clinic, my staff, my health system. I linked our QR code there. That's our QR code that takes you back to our educational series, whether it's put on by myself for our provider education or whether it's one of my other colleagues doing education, for example, like Beth and Tim out today at Circles of Life. The other request that I frequently had was an email introduction, if you will, to other key informants doing similar work or maybe facing similar challenges. What are the next steps for our environmental scan? We're going to continue to identify those key informants from our health systems that haven't been captured. So spoiler alert, if there's anybody on the call today that maybe knows someone in one of those systems we identified, we're looking for information, we're looking for informants. So still looking for those contacts in, especially those three systems, or I'm sorry, the two systems where we have none, and that's SSM and ProHealth, as well as maybe some alternate contacts through Aurora, HSHS, or Mayo. We're hoping to complete those interviews and hoping to continue some qualitative analysis of transcripts. And that's the next few slides where our director, Ann, is going to hop in and tell you a little bit about the work that we're doing on that qualitative work.
Yes, hi. So we want to continue to do some analysis of the interviews we've done so far, as well as complete, at least if we can, the 10 major systems, and maybe going back to some of our minor or less, systems that we know might be doing some transition work, and seeing if that can also be captured. But initially, we're going to transcribe our interview and mine them for themes, and we're going to use this a qualitative analysis software called In Vivo to code and analyze these interviews in a more structured way. I think we're kind of curious to see, because we have a lot of information, if anything else emerges, although I feel like Julie and Wendy have just done a great job of kind of summarizing what our conversations have told us. But we'll be wanting to do this for our final report, which will include that quantitative data. And I think at the end of last year, we conducted potentially 3 interviews, and at that point, only one system had been identified with a structure. So our state performance measure was like 1 out of 3 that we've been able to contact. So hopefully by the end of this year, we'll have more of something to report in our final report for the state. But it's been an interesting process because I think, again, as Julie mentioned, COVID and other things have kind of interfered with some of the transition work. So we are understanding that, and we probably need to report on that. I think some of the work that started before COVID has been interrupted, let's put it that way. Whether it's been abandoned completely, I don't know. But our next activity, if you will, for this learning community was to actually have a discussion about some of the things that we've learned, and maybe tap into some of what you might know that we don't know yet. So these are just discussion questions, and there's 4 of them. maybe just first of all, and you could unmute or put stuff in the chat if you have some things to tell us. What surprised you or didn't surprise you about what we learned, either in Wisconsin or the literature that report from 2018 has been out for a while, and we've been using it in a number of ways. Seems consistent across states, but maybe something in Wisconsin is different from what was in that report. So any thoughts? I'd like to leave the questions up, but I also, if you want to maybe unpin the presenter, and we can just have people, if you want to unmute or unmute your camera as well, and or your phone. I think there's maybe one or two people on the phone that we could hear from you. So just starting with what we've talked about, what surprised you or didn't surprise you. I know it's, and again, if you feel more comfortable putting it in the chat, that is fine. The second question, and again, we'll wait for other responses, or you can address any of these. Oh, Lynn's saying she can't unpin. So, okay, I'm not sure how to do that either. I know Nicole's on, maybe she can help us. We've got some other team members from our Wasteman Center here. So I know, and I think I saw Judy Stike is now on, and not that you have to answer any of these things, Judy, but Judy did a lot of initial work looking at the literature about healthcare systems and practices, and I don't think it's necessarily changed, but I'm wondering what others have done, maybe besides Judy, that to even approach learning what a healthcare system does. This is, you know, we took an approach, and there's other groups doing different types of environmental scans, but we really wanted to just get in and find out what our healthcare system's doing. And I, you know, certainly we started, and I know Julie didn't talk a lot about it, but we did start with a web-based search. We looked at websites of major healthcare systems and some of our friends, and tried to find out what, not that they're our friends, but they're just, I mean, not that the health systems aren't, but just to try to find from a very basic perspective, what could you find out if you were just interested in healthcare transition? And very few sites had much information on them.
I agree, Anne, and I will tell you that was probably one of my surprises out of the last 18 months on this project. Is I, as a clinician, thought I can figure out how to get into these systems. I can dig in and I can find the people that are doing this work. And I know, you know, we all know that transition work is really siloed. We know that, but I still was pretty confident that, hey, we can dig in and find these people. And it has been very challenging. And like I said, really mirrors that how much of a challenge it has to be for our patients and families. If I, as a clinician in one of these large systems, am having difficulty finding the people doing this work. So that was a big surprise for me.
This is Meg Steinley with the Southeast Regional Center at Children's, Wisconsin and Milwaukee. You know, one of the things that was stated to me, and this was in my own personal experience.
Back up on the slides. Sorry. There we go. Thank you, Meg. Sorry to interrupt.
That's okay. My own personal experience was when our pediatrician died and we had to find a new provider, and my son was 13, I thought, oh my gosh, I don't want to have to go through another transition with a different doctor, you know, when he gets to be 18 or 21 or whatever. So we found this doctor, and again, it was through some pediatrician colleagues that said, oh, try this person, whatever. And so then I got with that provider, and we used some of the tools, you know, in a very rudimentary way that Got Transition had. And when I was talking to him about transitioning and whatever, and he said, you know, that's a term that they use with seniors. with senior citizens
Mhm.
is transition, adult health care, and it's, you know, aging. And I'm like, oh gosh, you know, so I'm curious
Mhm.
about and
The
maybe this
word.
was a question, but is when we ask the question of these providers, are they understanding the youth health transition and not like aging? I'm just curious. That just
Yeah.
popped into my head during this discussion.
Good question. And I know Julie can answer it more specifically, but I'll give you the general overview is when we did solicit these interviews, yes, we were very specific with the definition. But I think, you know, maybe going back to that website search, you know, maybe we should be using different terms and looking for, you know, when you get into things like transfer of care, though, it has a different connotation. And so that hasn't really helped us either. And then we often got into sort of discharge planning, which I think actually may have been one of the ways that Judy got involved in this work. But so some of the terms that you use are absolutely important to figuring out how to get to the right people or to the right service, if you will, or the activities that you're looking for. So good point. And we'll think about the terminology a little bit more, but we did in the invitation, at least for the interviews, we did very clearly specify the type of transition we were talking about.
Yeah, I recall that now, but
Yeah. Anybody else have another perspective to offer? And the last two questions, again, knowing the challenges and barriers, what other strategies would you suggest for help us complete our environmental scan? There's other things, but no set format for how to do this. And then finally, many of you know that we're involved with an integrated transition planning coalition that is looking at weaving healthcare transition into other types of transition planning processes. Of course, the point of the webinar today is that we're really looking at what our healthcare system's doing. But if another way to approach it is to sort of be more integrated in helping other systems include healthcare. So we're looking at it from both perspectives in order to advance families' access to healthcare transition planning. So any other thoughts or perspectives to share?
Well, this is Judy. I'm really sorry that I wasn't able to join on the first half and really hear the actual presentation. I came in just when I saw this slide up, so I'm not privy to exactly what was said today. But I will say that I think in order to kind of motivate this forward, it really takes a keen awareness of the need or creating a compelling need. When I did my work, I really focused in on people with disabilities, and the challenge there is that in the larger world, there's still an evolving appreciation for healthcare for people with disabilities, and in that context, as and you may have already talked about this, but in that context, there's all these attitudes and biases that are out there that have to be overcome, particularly with people with disabilities.
Mhm.
But then in the larger picture of just looking at every youth, every young person who is moving forward in their life from the so-called elementary, junior high years into kind of more of the adult world, I don't know that there's much appreciation yet for I mean, we all talk about how teenage years can be so challenging, but we don't really talk about it in the context of health as much. And I think that's really where a lot of narrative needs to occur yet, with regard to the importance of that transition of health. And I think it's really critically important now when you see so much of mental health needs among the youth, and it's really important that we recognize that more and think about, well, how are we going to support these
Support that.
young people as they get into the adult healthcare world, and how can we help them
Yeah,
navigate?
and I think the fact that it doesn't happen automatically is sort of another theme that emerged. But I think, Julie, you can correct me if I'm wrong, but I think you did hear from some folks that didn't have a systematic way to that. Well, of course it happens. They age out and they have to go to adult providers, and so they do. And yet we do know from the literature and other family stories and stories from youth themselves that they can sort of go drop off the healthcare radar and or get lost and confused about where to go next. So it doesn't happen really automatically, and that's kind of what we're trying to look at. But we did still hear that. So again, increasing awareness, as you said, Judy, and that certain special populations really are going to require some pre-planning and some concerted assistance to make it into their next health care home.
Yeah, and the other thing too is the involvement of the school systems. I think they have sort of a needs-based approach to health, in the sense that if we need a nurse or if we need healthcare, we'll get it in here, but they're not really thinking about that.
Right.
And I'm not suggesting that the schools have to take on everything in everybody's lives, but at least it's a venue where there could be more conversations about health, and about what is it like in the adult world, and taking on responsibility for your own health.
Right. And not just waiting until the ER, because I think that's kind of a shock that happens to some people if something goes wrong and they go where they've always gone, and then they're told, no, you have to go over to you have to get this other set of providers. That's what we don't want to have happen. Yeah.
Well, and I would also add the Wisconsin DPI has their post-secondary transition plan 2.0, which now has the option to add a health-related goal, if you will.
Right.
So I think it's, thinking about all of the partners that we have. So like the Wisconsin Transition Improvement Grant. I think about our medical home initiative, and how can we do some maybe education, from the youth health transition perspective to those two groups to help, really help create some of that. Maybe there needs to be, and this, I'm just thinking off the top of my head, but with our medical home partners, do we do training with them, with the Yeti curriculum, to do transition trainings like they do the Ages and Stages 3 questionnaire trainings, or the MCHAT trainings, or whatever.
Right.
I mean, that might be something to think about as just taking a different tack to education of the providers and clinicians, so that we're kind of hitting it on all cylinders, if you will.
Yep. And that's why I think that involving, maybe some outside of healthcare providers or systems would help as well. Yep, absolutely. So, and I actually meant at one point to share, we have a new website for the Integrated Transition Planning Project. So maybe Nicole or Lynn could put that in the chat, but we are really working across systems to try to improve. And one of the integrated transition planning initiatives is to include healthcare, because it seemed to be the missing partner in addition to education and employment planning. So for those of you who don't know about that initiative, I think the website just got newly launched website just got put in the chat. So there you go. So I think we could, we're very open to other comments or suggestions. We'll move to the next slide, and I'll just, we wanted to close on a positive note, which even though we're struggling to find evidence of a systematic approach to healthcare transition within healthcare systems, we have got some data from our National Survey of Children's Health, which does a basically a phone survey to families. So these are parents answering this questionnaire. And the measure that looks so promising is that the blue line on this graph shows that over the last 3 years of data that we have currently, our 34% of the parents filling out the survey said that their adolescent aged 12 to 17 years old received services to support successful health transitions. And this has been a continuous improvement over 3 years. So we want to believe that the trend is going upward. I'm surprised that the number seems so high when our healthcare systems are not very well organized to support this, but for whatever families are reporting that they are experiencing in Wisconsin, some supports. So but still only a third of families. So the number is still not where we want it to be. Our goal was only 23% because I think we started at 17 in 5 years ago. So it has improved, and we'll hope it stays improving. There may be some year-to-year fluctuation, but we wanted to say that at least one of our state measures for this transition from pediatric to adult care looks like it's going in the positive direction. So that was our good news. I think our final slide is next. And just to say thank you for joining today's call, and the evaluation link is in the chat again, I believe, or here on the screen